seems to be the hardest word. This was the opening title of Season 10, Episode 9 of the Netflix drama series Grey's Anatomy. Now, this particular episode featured the case of an Olympic athlete suffering from severe arthritis who came in for a hip replacement surgery. And everything seemed to be going fair and well until a couple days later, where the guy is found with a nasty infection at the site of the procedure. The episodes following were filled with court cases, legal drama, and tons of angry old people shaking their fists at doctors, all regarding a dramatic case of medical malpractice. But here's the thing. While it might be easy for us to get hooked onto a drama series on Netflix, in real life, medical malpractice is not just some over-the-top storyline, but a serious issue that we face. And when just this past year, a report by Johns Hopkins University claimed that malpractice was the third leading cause of death in the United States, it's become quite imperative that we analyze this topic. Hi, my name is Niveditha Sudheer. I'm a senior at Blue Valley High School, and today I'm going to help unravel a hidden yet scandalous part of the modern healthcare system by first cutting open the history of malpractice and its general standpoints, then looking at its implications and ethical dilemmas, and finally, stitching together the impacts of malpractice and what it holds for society, and understanding why we must address it. Now, don't get me wrong, Grey's Anatomy definitely had its inaccuracies, but malpractice, on the other hand, is something that's had quite a long run, dating all the way back to ancient Mesopotamia. While the ancient world was figuring out how to treat basic infections, they were also figuring out the legalities of medical responsibility. A pivotal document that first portrayed this was called the Code of Hammurabi. This was an ancient Arabic text that officially introduced the concept of malpractice and the importance of taking action against such cases. Similarly, in ancient Greece, Greek philosophers like Aristotle and Plato further set the benchmark for modern medical tactics. This eventually got the Greeks to open up something called the Hippocratic Oath, a philosophy that's still widely used today, and essentially boils down to the idea of do not harm, regardless of the circumstances. And with all of that, you would think something like this would instill a sense of, integrity amongst people. But it turns out the Europeans completely just disregarded this idea. And a couple of centuries later, the world sees its very first recorded case of malpractice in the year 1374. Stratton v. Swanland, which revolved around a surgeon's inability to fix a woman's deformed left hand and was thus put to trial. But the case was later dismissed when the judge claimed the physician wasn't negligent, nor did they bring additional harm either. So I guess you could say the patient was all right now. Throughout the early 19th and mid-20th centuries, the United States starts to see a huge sweep in cases of misconduct, eventually leading many states to pass bigger reform laws and publicize its standards. And yet, today, malpractice continues to occur at a higher rate than ever, occurring in three primary forms: misdiagnosis, failure to treat, and surgical errors. Misdiagnosis being the most common of the three, occurring when a physician incorrectly diagnoses a patient. In 2014, comedian Joan Rivers brought one of the most popular cases of misdiagnosis: a lack of oxygen leading to severe brain damage. And on the outside, this seems like something extremely complicated, but diving deep, it was found out that this could have been completely prevented if the situation was caught early on. Now, in some cases, the diagnosis might have happened, but not proper treatment. In history, we see this with the king of pop himself, Michael Jackson, who was accidentally given an overdose of 14 counts of medications, ultimately leading to his death. And lastly, the most appalling type of misconduct is errors in surgery. In 2007, a neurosurgeon at Rhode Island Hospital made catastrophic errors by performing wrong-site surgeries on not one, not two, but 3 different patients' heads. And despite one of the surgeries even killing an 86-year-old woman, the surgeon just had their license revoked for roughly about 2 months. And yes, 2 months. That's about the amount of time it takes to binge-watch all of Grey's Anatomy. And that's the exact time frame that this surgeon had their license suspended for before being allowed to continue practice as normal. But the impacts of malpractice can go beyond general borders, often highlighting deeper issues within our modern healthcare system. Because malpractice isn't just about individual mistakes. Because the ugly truth is, it often disproportionately affects marginalized groups of people. In fact, a study by the NIH, or the National Institute of Health, and Columbia University show that malpractice claims are especially high when it deals with women's health. Women are approximately 30% more likely to get misdiagnosed of a particular disease than men. And this is oftentimes due to the lack of research in female-centric conditions, or simply because they didn't pose the same symptoms as their male counterparts. Take heart attacks, for example, a condition that affects over 800,000 Americans every year, with millions and millions of dollars being put into research and clinical work. And yet, studies show that women continue to be at a higher risk for cardiovascular problems than men. And what's even more surprising is that despite many diseases simply being tied off as a hormonal issue, there actually hasn't been much research into female-centric or reproductive issues either. Take conditions such as endometriosis or uterine fibroids, diseases that affect nearly 58% of women and don't even receive half the research assets as conditions that are more subjective to males' health. But that's not all. Even going beyond the gender stigmas put on women, research and studies have shown that even factors like race has also played a major role in cases of mistreatment. A recent poll by the KFF, a health policy research group, found that about 1 in 5 Black Americans and about 1 in 10 Hispanics reported being treated unfairly or with disrespect by a healthcare provider. Additionally, nearly 55% of such respondents said they feel like they should be careful about their appearance and brace for an insult every time they went for a checkup, all in hopes of getting a fairer treatment. Now, I'm not saying any of this to show that doctors are racist, sexist, or stupid, but it raises a question of, well, what exactly is the root cause of such skyrocketing forms of misconduct? I mean, is it just pure negligence, societal stigma? And while we've seen that both of those are suitable answers, it's also an issue with the healthcare system itself. A system where, in the process of advancing science and research, also has a tendency to reduce people to mere test subjects. A system that forces healthcare workers to be overworked beyond limits, and thus reducing their ability to provide the best treatment possible. A system that prioritizes profit more than a genuine concern for safety. And with the rise of new legislation, such as the ACGME's policies on extraneous work hours, and states now passing their own medical liability laws, it's clear that there have been steps taken to mitigate the risks of medical malpractice. But there's still so much more that needs to be done. This year's TEDx topic was regarding the theme of inspiring change. Now, I'm going to tell you that sometimes to do so, you don't need to perform anything extraordinary, but simply acknowledge the issue at hand, stay aware, and analyze what could be done better in the future. I'm not here to tackle the healthcare system, but simply show a side of it that goes untouched. To the aspiring doctors, nurses, and future scientists and leaders, it's the mindset that matters. The mindset to learn about the status quo, the mindset to insist on better, not just faster or cheaper, and the mindset to act now and stay informed. And right now, it's more important than ever that we as a society stay informed about the untold inequities that happen in one of the largest industries in the country. Today, we took a dive into arguably one of the most scandalous parts of the modern healthcare system. First, we analyzed its origins, then we looked at its implications, and finally, we understood the impacts of medical malpractice and why we need to address it. So while Grey's Anatomy definitely might have had some over-dramatic moments, the next time you find yourself going for your next checkup, walking into a clinic, or even switching on some Netflix to watch another medical drama series, maybe keep in the back of your mind about the cuts, the sutures, and the oops of medicine. Thank you.